You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says nobody should be wearing a loose-fitting denture. With us we have Illinois' periodontist, Dr. Flynn. Dr. Flynn, welcome to the program.
Thank you for having me, Randy. I'm really excited to be here to discuss these topics.
Okay, good. Now, you brought a lot of photos.
Yes.
So we'll get to as many of those as we can. Now, for people that don't know your practice, you're a periodontist, you do a lot of dental implants, you take care of people, I guess, with gum disease. But who's your typical patient these days that you see?
I see a wide range of patients, Randy. I see people that have periodontal disease or bleeding gums or like a bacterial infection that erodes away the bone around their teeth. Also do a lot of aesthetic work for recontouring gums and giving people a great looking smile. We see a wide variety of people that are missing teeth that need implants. Some people are missing one or two teeth. Some people all their teeth, the denture wearers. We do implants for stabilization. It's hard to get those people in. And then we have people that just have bad teeth in general that need replacement and want to improve their smile and their eating ability.
So it is like a new set of teeth.
Absolutely.
I mean, these dental implants.
Absolutely. It's almost like a third set of teeth.
Is that right?
Yeah. People can come in, and if their teeth are bad, we can replace the missing teeth or stabilize their denture so they can eat, chew, and do the things they love.
Now, as a periodontist, you work with the general dentist also, like as a team in town.
Yeah, we work with a lot of general dentists. We'll work with anybody's general dentist or anybody's dentist. It's really a team effort with a good lab and a great dentist, and we can achieve really good smiles and really good capacity for somebody to chew and eat.
Now, we should mention, I guess, how it's typically done is you go to one doctor that does the surgery, you go to another doctor that puts the teeth on top, maybe an imaging center, and you do it all right there.
Yeah. The whole thing happens in our office.
Okay.
Dentists come, a laboratory comes, we do all the imaging, everything. It's all done under one roof, so the patient's not having to go all over the place to have this sort of treatment done.
Are there a lot of people, like where you are, let's say within 100 miles of your practice?
Oh yeah.
A lot of denture wearers?
Within 50 miles, if you line those people up, you could fill up Wrigley Field where the Cubs play and Soldier Field where the Bears play, and Kaminsky Park where the White Sox play multiple times.
Is that right?
There's something like 40 million people in the United States alone that wear dentures, and at least 120 million people that are missing at least one tooth or more, and those numbers are expected to climb over the next 20 years.
So then if dental implants are so good for the denture wearer to come in and I guess just snap them in, snap out, or fix teeth, why aren't they all doing it? I mean, what's your take?
So my take on this is that people that are wearing dentures or don't have teeth, they don't go to the dentist. They're out of the dental world. They're out of the loop, you might say.
All right.
I don't know if you understand the road that those people take to wearing a denture, but it's a long, and they're usually very fearful because of all the stuff they've been through to get there. They usually have multiple appointments, maybe even hundreds of appointments with dentists, dental specialists.
These denture wearers.
These denture wearers.
Before they lost their teeth.
Before.
So
yes.
Just a lot of money spent to try to save their teeth.
Correct. They've gone through root canals, extractions, fillings, maybe bad breath, sensitivity, poor fitting partials, extractions. It's a snowball of expensive events that leads them to where they were trying not to end up in the first place wearing a denture. And the last thing they want to do is see me. And then when they finally have their teeth or last teeth removed, it's a relief for those people. They feel,
so getting them back in is tough.
Yeah, that's the challenge. It's really hard to get those people in because they're out of the loop.
How old can you be to do this, to get implants?
I've done people in the 90s. Age doesn't matter. Age has nothing to do with the success rate of getting or having successful dental implants. I had this one gentleman that then been my patient. He's actually my longest standing patient, Randy.
Okay.
I saw him when I was a resident, and I did some implants on him way back like 30 some years ago, and over time we reconnected, and he had some failing teeth, and his teeth were breaking down and breaking up, and he had a lot of decay, rampant decay running through his mouth, cavities, eating away at his
90-year-old
teeth.
guy.
This 90-year-old guy. And so what we did was we removed the bad teeth, and we actually didn't have to even touch the other implants. We built around those to give him a fixed set of lower teeth that function just like a set of natural teeth. And now he's able to eat all the things he wants. He can chew pizza and eat hard bread and steak. And he loves eating fish, but he also loves those other foods too. Another thing about him, what was interesting was he was a retired professor, and in his later life, he decided he wanted a career in acting, and he started doing theater, and he started doing TV commercials. And when he came in, he told me, you know what, I'm tired of playing the sickly old patient, and they ask me to take out my teeth, my partials, my denture, and I don't want to lay in a hospital bed for an insurance commercial and look like the sick elderly guy. I want a better part. So that was a lot of his motivation for also coming into having that done.
So now they're using him as like clip art or for a healthy senior.
A healthy senior. He's more of a healthy senior.
Is that right? Now, you brought some photos. What are we looking at?
Okay, so let me show you this first case, Randy. This is oh my goodness, a lady who came into my office, and surprisingly enough, she's the mother of a dentist who refers a lot of cases like this to me, and he had been asking her for years to come in and have something like this done.
What is that?
She's got a lot of gum disease and recession. She's got some failing bridge work there.
So that's just like a removable
bridge?
That's actually like a bridge?
It's actually a bridge that's secure on, but in her case, it's rotted out all underneath, so it's moving, shifting, her teeth are moving. She's unable to eat the food she wants to, and she doesn't like the way it looks.
Now that's got to be unusual to see something like that.
No, that's common, but you don't see it because people like this usually don't smile. They usually smile with their lips closed, or they're embarrassed by it. You don't see pictures of them on Facebook or anything like that with smiles like this because it doesn't look attractive.
So all of those teeth had to go. What were her options?
So basically she had a couple options, but in her case, her doctor, which is her son, said, hey, I would like you to provide her a fixed set of teeth that are anchored, that she doesn't have to take out and clean outside the mouth.
So no denture for her. She didn't want a denture.
No denture. She wanted no denture, and he wanted no part of that for his mom. He wanted the best.
Okay.
So what we did was we removed those teeth, cleaned up all the infection in the gums and the bone, and at the same day, we put in some implants. Her son was there. He installed the teeth with the lab there. They customized this and gave her the smile that she always wanted or hadn't had in a long time.
Very nice.
And now she's smiling, and you can tell from that picture she's got to learn to smile again. She's unable to smile as big as she was there.
So she can eat whatever she wants. I mean, she could bite a carrot with those front teeth? Raw?
Definitely. She can bite a carrot, snap it right off. She can eat an apple. She can eat steak. Whatever she desires. They function just like natural teeth.
So there are people that you said that can literally, on the day of the procedure, can walk in without teeth and leave with teeth that don't come in and out.
Absolutely. With today's technology and the use of a great lab and good dentists coming in and working as a team, we're able to provide these services at the same day. We can remove the bad teeth, clean up the infection, put the implants in, and customize a smile just for them.
Now you say people with bad teeth are judged.
You know, a lot of times people, when they have bad teeth and they don't smile, they don't do as well in like job interviews or promotions, or they get judged. You know, you look at somebody like that in that picture, and people make a judgment about them that maybe they're low on the social economic chain. But you look at the other picture and you look at that smile, and another thing about her was that when she spends half her year in Florida, she's 83, and the people that are at the place where she's living in the winter have complimented her numerous times, and I'm sure that after
they look real.
After she smiles enough for them, probably after the 10th compliment like that, she'll be smiling bigger and bigger and bigger, and she'll have the confidence to do that.
So you have more photos?
Oh yeah, I have a lot of photos, but let me show you this gentleman here.
Okay.
Here's a patient that came in, and he's had his teeth been crumbling, he's had root canals, teeth breaking down, pain, more root canals, more pain, and then we want to give him a beautiful set of teeth. Here was some options he had. He could get a full set of dentures, or he could get a full set of fixed teeth put in. He wanted no part of the denture. He said, hey, I had a partial before, it didn't work for me, it moved around, it was sloppy, I couldn't speak, I couldn't eat, I didn't want anything to do with that, he said to me. In one afternoon, we were able to give him this, Randy. Look how rounded, and the curves and the whiteness, it doesn't even look like the same guy. You know, he loves his new teeth. I want you to notice how natural that looks. This gentleman is 40 years old. His teeth in the before treatment looks like he was 90-year-old. 40 is way too young to be wearing a denture. Even 90 is too young to be wearing a denture. And now we gave him age-appropriate smile, age-appropriate color. He's smiling all over town.
Well, that's good. That's good. We have time for a couple more photos.
Here's a gentleman here. I want you to look at this smile. He had horrible periodontal disease, bleeding gums, his teeth were flared, he had a bacterial infection that was eating away the bone around his teeth were loose, he was unhappy with the way his appearance looked and his teeth looked. He said that he had bad breath and he needed to change it because of his job.
Okay.
And so after some good evaluation of him, we decided that he had some options. He could either go with a denture or some sort of snap in, snap out, but he said, no, Dr. Flynn, I want teeth that stay in my mouth. I don't want dentures. My parents had dentures. I want a fixed solution that's anchored in, and I want to be able to eat, and I want to be able to smile and look good.
Okay.
And I said, okay, we can provide that for you. And in just one afternoon, look at the difference
Very
there.
nice.
No more flare. His teeth look great. We were able to remove his remaining teeth, clean out all that periodontal infection, put in some implants, and with the help of his dentist and the lab, we were able to customize a set of teeth that were also age appropriate. He's in his 50s, and his teeth, they look amazing.
Okay, yeah, it looks. Now, what about pain? It does seem painful, though.
It's really not something that people really complain about. All these cases here, we did with just local anesthetic. We were able to do everything with local anesthetic. Just numb the area. That's it. I mean, we offer sedation. We offer some other conscious type sedations as well. But most of the time, it's not necessary. We don't need to do this in a hospital. We do this right here in our office daily.
Is that right? And then as far as after it's all done, you give them some pain medication to go home with?
Afterwards, people, not a lot of complaining. People take just some pain medication. Most people return to work in the next day.
Okay. And some people take like Advil or Motrin or whatever you give them?
Yeah. Most people just ibuprofen. Sometimes we prescribe some other stronger medications just to have on hand. Everybody's a little different. The gentleman, the second case I showed you, he said he barely took anything. So
what are the options for denture wearers, like, or somebody that needs a full mouth of extractions? What are their options when it comes to dental implants?
Well, there's options of dentures, obviously. We've talked about that. But the next option up from that is usually as simple on the lower. 2 implants where teeth snap in and snap out. Eliminates a lot of the goos and gels. That's messy. A lot of people have issues with those.
Can you eat with those? Like the 2 implants snap in, snap out?
Oh, definitely, definitely. It's a lot better than a denture. It gives it some stabilization. There's not as much pressure on the tissue. It's a lot more comfortable. You can't get away with that on the upper. Typically that takes a few more implants, usually 4 to do a snap in, snap out on the upper. So the next level up, more stability. We can add some more implants to the snap in, snap out. You could do 4 implants on the lower.
So full arch and just
full arch, snap in, snap out. You get a lot more stability. You can eat stuff like salad, but you know, even with the snap in and snap outs, you still get food caught under them. They got to come out. You got to be cleaned out of the mouth. They need to soak in tablets and sterilize them. The next level up is what everybody wants. They want fixed set of teeth that don't come in and out. They don't have to clean them in their hand or keep them in a cup or take them out when they sleep. The fixed set of teeth, it functions more like your natural teeth, Randy.
Like what could you eat with it? I mean, are there limitations?
No limitations. If you want to eat peanut brittle, if you want to eat corn on the cob, bite into an apple, a juicy steak, people love it with the fixed option. It brings them back to where they should be. and where they were a long time ago before they got to this spot. So I had this one lady that came in. She had a denture. She's hated it. She told me a story that really hit me hard. She said that she would go out to eat a lot with her husband, and she had this denture, and she used a lot of the gels in there and adhesive to try to keep it in. And they would go to dinner with friends or family, and she had a very limited menu on what she could eat with that. And a lot of times she would watch the people she was with order food that she really wanted to order, but she had a very limited menu what she could eat with her denture because it didn't fit well. It was secured in by the adhesive, and typically what she would do is in the middle of the meal, her denture would slip and it would become unstable because once the adhesive got wet, it wasn't sticking anymore. So she would have to excuse herself into the restroom, and she said, I have to clean out that goo and gel and reapply. I couldn't do it in the restroom. I actually would go into the stall, she said, and clean out all that goo and reapply it, and she said it would take forever. And then she would come back to the table and her food would be cold, and she said she felt bad too because her husband, he knew what was going on, so he kind of felt really bad for her. Or a lot of times she told me that if it was later in the meal and it slipped, she would just not finish her meal at all and just say she was full and not hungry anymore. And then what happened was we ended up giving her a fixed set of teeth, and that was after that she shared this story with me. And when she looks at her teeth, she couldn't stop thanking me. She doesn't stop talking when she comes in. She's so happy now that she's had this done that she's looking forward to doing the lower soon.
Now, is this one of those things that everybody says, like, I should have done this a long time ago?
Almost.
Like these photos. I mean, they had really bad teeth, probably going on for 10, 15 years of not liking their teeth.
I don't think anybody's ever said they wish they would do it later. They all wish they would have done it a long time ago. Just because of the compromises they realized that they made throughout their life to accommodate this type of disability.
And now, we talked a little bit in the green room about this, but if the denture wearers somehow got together and found out how good dental implants were, that means to get their teeth back or snap in, step out, you said that, like, there's not enough dentists in Illinois to even handle the demand.
No, if everybody found out how great this was, there wouldn't be enough good doctors in the area or specialists to provide this kind of service.
So you've been doing dental implants for a long time, right? Since the 80s.
Since the 80s, yeah. It's changed so much since then. Back then, there was longer waiting times, more surgery. The technology with the implants was just getting really started and developing some of the newer techniques.
So in the old days, it was like 9 months, yet it took just a...
Sometimes it took 9 months, a year to get teeth after you had implants. And now things are moving more towards minimally invasive, kind of like a lot of areas of medicine like arthroscopic surgery, robotic surgery. With implants, it's guided surgery. We use special surgical guides now to do these that make them a lot less invasive than what they were back when I got started. Things have changed greatly with imaging. Imaging allows us to see everything we need to see and put these in. We used to do these with just plain old regular x-rays, and now...
What was the problem with that?
The problem with that was we couldn't see everything that we wanted to. There was some guessing involved in that. We didn't know how thick the bone was.
So what, you had to cut them open more?
We had to cut them open more, and now with guided surgery, sometimes we do it without making any incisions. We just put them in right through the gum. Small little slit in the gum, that's all that's needed.
So it's actually fairly easy, but I guess people are just afraid of the fact they hear surgery. Is that what it is?
A lot of times people are fearful. They don't know what to expect. Sometimes they actually think that, that the denture is just good enough for them, and they settle, which I think is really sad in general. It reminds me of one gentleman that I had come in to see me. He said, "No, doc, I don't want I don't want anything to do with implants. I just want my teeth out, and once my infection and gums heal, I'm going to go get a denture, and I'm going to go on with my life. I don't want any part of that. So he came in, we took out his teeth, we cleaned up all his infection, everything was healed up really good. He waited his time period, he waited like 8 weeks or something like that, got his dentures made, and about 2 weeks after that, he showed up in my office with his dentures in his hand, and he says, listen, my dentist made these for me. I can't do this. I can't wear these. It's horrible. He said, I'm not able to eat the foods I want. I like to grill. And we shared a bunch of recipes about grilling with him. And I said, well, maybe you're eating low cuts of meat. And he said, oh no, Dr. Flynn, I only buy the best cuts of meat that I can cut with a fork, and I still can't eat them with my denture. He says, I don't care what it involves or what the costs are. I would like to have fixed set of teeth. So we gave him fixed set of teeth, upper and lower, and he's a happy camper and a happy griller now.
So he can eat whatever he wants.
He can eat whatever he wants now. And also, you know, the gentleman lost a ton of weight. He looks great. I don't know what's happened, but I would assume that a change in a diet, a much healthier diet, he's able to eat fruits and vegetables, things that he couldn't eat besides high carbohydrate foods that he was eating while he had teeth that were broken down or failing or infected gums. Or even with his denture, which he didn't wear for that month he had him. He said he was gumming his food.
So you called it earlier the third set of teeth. It is like a third chance, right? Baby teeth, adult teeth. You lose those.
Now your implants are really like the third set of teeth.
And they use terms like permanent. So these are like approved to be permanent teeth.
These are considered a permanent replacement.
Now you're a periodontist, a dentist. You probably think the smile is like the most important thing.
Dentists or not, a smile's important. Like, just think about Hollywood in the movies. You want to make somebody look like the villain, you give them bad teeth, broken teeth, jagged teeth, teeth that are darker in color. You want them to look good, be the hero, you give them a bright, shiny smile. People are judged by their teeth. They think that they're dirty and not clean. It's kind of sad that people make those assumptions.
But aren't they just
on
neglecting their teeth? That's
Absolutely
why they're so
not.
bad?
Some of these people are the people that clean their teeth the most. Some of it's genetic. They just don't have the ability, or even if they have the ability, they're still breaking down no matter what.
So you say it's like a bacterial infection?
It's a bacterial infection. As a periodontist, definitely. It's like a bacterial infection that either is eating away the supporting bone, their jawbone, making these teeth loose and wobbly and flaring out, or it's bacteria that's causing cavities or decay.
Okay, so you clean all that up.
We clean all that up. Sometimes we use a laser. So what's great about that is once we remove the source of the problem, which is usually the teeth, the infection clears up, we clean it up, the remaining infection, and then they have healthy gums and bones, so we're able to do implants into these spots where they need to get teeth replaced. So I'm a periodontist, and you asked me if I think teeth and smile are important. Let me tell you about this one patient who came in. Actually, his wife came to see me first. She was my patient for years. We did some implants on her here and there as she had lost some teeth. And along the way, she had told me she was trying to get her husband to come in to have some work done. She said his teeth are really bad and he's really fearful, doesn't want to come in. And then one day, he had a horrible toothache. And it was finally the thing that motivated him to come in and start some work. And she brought him in.
Are guys like that, by the way? Like
guys are very much
they have to be in
like
pain first to go to the dentist.
Oh, definitely. Guys, they tend to put it off. Like me, I tend to put some stuff off as well. But his wife finally got him to come with this toothache, and we were able to help him out. We actually removed the tooth that was the source of his pain. He was very pleased at the service we provided for him. He said that it was minimal in discomfort. And then he got to thinking that, hey, you know what? Maybe I've been putting this off for the wrong reason, and I'm going to go in and get something done. And after we evaluated him, all his teeth were failing. He had gum disease. He had teeth that were rotting out. He had bleeding gums, bad breath. Funny note was when he first came in, I saw him, he was always in like sweatpants, and he had dirty tennis shoes, looked like he'd mowed the lawn in them for the whole summer. Very unkept. Hair kind of matted down, glasses. His appearance was one that could easily be judged. But once we did some of his teeth, and we actually staged him out, he didn't really want to do the top and bottom together like a lot of people want to do, which we can provide. He actually wanted to just do his top teeth to start. He was kind of testing the waters with this. First he tested the waters with the one tooth getting out. Now he was ready to move on. So we removed his top teeth, cleaned out all the infection, put in a fixed set of teeth that didn't cover the roof of the mouth, screwed in, and after that set of teeth got installed, he came in and I noticed, well, hey, he's wearing some jeans, he's got some nice shoes, he got a haircut. He said, wow, I'm really happy with this. I'm ready to do the bottom. So we did his bottom, kind of the exact same thing. And then when I finally saw him, when everything was done, he was wearing khaki pants, nice dress shoes, a belt, a nice polo, tucked in, no more glasses, haircut. You know, his wife, she couldn't thank me enough, says he's leaving the house now. Because, you know, a lot of things like this, it holds people back. Their teeth actually hold them back. It prevents them from doing the things they really want to do.
Is it like anything else? I mean, if you don't like something about yourself, it does hold you back.
It holds you back. And, you know, it's sad because this is something that can be changed, you know, and when something can be changed that's holding you back, why not do it?
So final message. Somebody watching this, either they're wearing a denture that's loose or they don't like, or they're headed to dentures with bad teeth. And they've heard what you had to say, but they're a little afraid for whatever reason. What do you say to them?
I invite them to come on in for a free consultation. Know your options. There's a lot of options. We can customize care for anybody. And there's a lot of things that hold people back. Some people even self-diagnose themselves with a lot of issues. They think that, hey, it's too expensive, or I'm too old, or it's not right for me. Those people should come on in. Some people count their teeth and think that they have to have one implant for every tooth, and it's just not true.
I mean, you're saying like 4 or 5 or 6 implants give them a full arch of teeth.
Absolutely.
They don't come in and out.
We can, with as few as 4 implants, we can give you a fixed set of teeth that are anchored in, screwed in, that don't come in and out, that don't cover the roof of your mouth. You know, a lot of people come in and they tell me, hey, when they got a denture, I can't feel a warm cup of coffee. They lose a lot of sensation. It's just another shortcoming of wearing a denture that people adapt to or adjust to.
So no more dentures.
No more dentures.
Now what about insurance? And we literally are short like 30 seconds, but Medicare, Medicaid doesn't cover this at all. Dental insurance, even with the best, covers, I guess, a small portion. So what do you say to those people?
We have a lot of financing options for this. People do it anyway. People find ways. We actually have somebody in our office, and they're dedicated to finding ways to find that people can have this done. And people
are financing it.
People come in, they finance it all the time. They have multiple options for financing with us.
We're out of time. I want to thank you for coming on the show.
Well, hey, thank you for having me, Randy.
Great info. So they could go to your website, make an appointment. Did they get to see you on the appointment?
Absolutely.
Do you need a referral? Because I know you work with the general dentist in town, but do they need a referral to see you as a periodontist?
No, people come direct, and actually most people come direct to me from my reputation in town. And you can come in and get a free consultation, and we'll go over all your options thoroughly. Okay, good. Thanks again. Great stuff. You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you could help.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.